rightfully so.
Yeah.
And so one of the things that's always important to me as the doctor explaining things to the patient or to their loved one is to very clearly sort of lay out what I'm thinking, what I think is going on, why things are happening the way they are in terms that make sense to them, right? And to let them know, look, I am doing everything we can, right? They're getting our absolute best. They're getting to, and I tell everybody, we're going to take really good care of them, right? And whether people believe that or not, that's up to them. But I always tell them that. I say, or people ask me, they're like, if I'm giving them a choice, and they'll say, well, I don't know. And there've been times where I'm like, look, if this were my parent, my brother, sister, this is what I would do. This is my medical opinion, right? And I just try to give people that reassurance. And I try to tell people, I can't necessarily sit at their bedside for 2 hours at a time and hold their hand and talk to them and help them work through the anxiety like I did with Vanessa. But I try to take what I take out of that experience is I take snippets of that and I plug those little things in throughout my day. It's that little thing. It's like, yes, we're gonna take really good care of them. They're in good hands here. Or we're gonna do X, Y, and Z. I'm gonna call you at the end of the day, and then actually call them at the end of the day if that's the plan is. Or we're gonna talk tomorrow. Or when are you gonna come in? And I'm gonna come in and try to sit down and talk to them. And it's those little things here and there. It doesn't have to be some massive effort to all the time, right? You don't always have the time or the bandwidth to do that, but it's just taking that time. Right?
Yeah.
Or not even taking the time, but it's those little changes in things you say or your behavior or how you interact with people that I think can have a huge impact. How you just work those little things in throughout your day that don't necessarily cost you a lot as a person, but to make a big impact on others.
Yes, like making eye contact with somebody, whether it's the patient or the loved ones that are seeing this person that they love so much in this really critical health state. But yeah, to make eye contact and to say, like what you said was, we're going to take really good care of you, or I'm going to take really good care of your mother. And like that phrase is soothing to me, and I'm not in the hospital right now. Like just hearing you say that is really soothing. And it makes me think too about, the mantras Vanessa and I have talked about too, is like just these really caring, thoughtful, human phrases can do so much. And like you said, it doesn't take a lot from the person.
Exactly.
We're
talking about like burnout and how do you take care of yourself but how do you do things that don't cost you anything? I remember when I was a resident, one of our faculty, she was a geriatrician, but she also would round in the hospital sometimes. She had this tiny little like folding chair. It was like almost like one of those little cane chairs you see older folks walk around with. And she would wander around the hospital with that, and she'd pop that down in a patient room, and she would sit. And I just remember doing that, and I think that this is like a little odd. And then I realized, the more I've done this, it's just something simple like I'm going to sit down or I'm going to squat down so I'm at their level when I'm talking to them, at least for a period of time. It's just these little things I think that collectively go a long way that cost me nothing.
Yeah, they cost you nothing, but at the same time, what you have done is you have put thought and you are showing that it's important to you. So yes, it doesn't cost you anything, and it may actually be one of the little things that fulfills you, right? To have that momentary connection. But the thing that I think is so beautiful, and I want to give you credit for, because you're saying it costs you nothing, but you've thought about these things. You've thought about that woman who brings her chair in. You've thought about how to be human, how to show up and be more of a human in those situations. And that makes such a difference, because I've talked to hundreds of people I know at this point about their medical trauma experiences. So much of the trauma comes from not being seen. Because yes, there is definitely the trauma of these scary situations and these painful situations and not knowing if you are going to live or die. But the thing that I often hear from people more than that is that they were not seen. They felt unheard, unseen. They felt dismissed. And so these little shifts and what you're doing with people, even when you said you can't sit and hold their hand for 2 hours, but these little tiny things actually can minimize, possibly even prevent some of the trauma that people are leaving medical experiences with. And so
Mhm.
I think it's a really big deal. I think it's a bigger deal maybe than you're giving yourself credit for,
Well, thank you.
because it really, really matters.